Hi, Dr. Nagy here. I had several questions in the past couple of days about what kind of mouth rinse to use. Several doctors as well as patients asked. So there's a couple of things to consider here. If you had orthodontic surgery, it's important that you check with your surgeon and you follow their instructions to see what kind of rinse they want you to use after the surgery. Sometimes they want you to use a chlorhexidine. The brand name is Paradex, like a Paradex rinse. And after a while they clear you to use that's just over-the-counter rinses. So I had several patients ask, like after they've been cleared for use any rinse, any over-the-counter rinse, several weeks or months after the surgery, but they still have some sore. What kind of rinse should they use? Because they're finding that things are not healing as well with Listerine, like especially if it's a cut or something like that. If it's a chronic problem, make sure you go back to your doctor and have him check it. But if it's just something that you had like a cut or something, or like a surgical side that just keep getting irritated with the brackets or your braces, one thing that works really well is a mixture of chamomile tea, cloves, and salt. There are several things that you have to consider when you have these cuts in your mouth. One is you need to reduce inflammation. Two is pain, and the third is sometimes you can get like secondary infections. Just an area kind of gets infected mildly just from the irritation and keep getting it cut open. So when you consider those three things, there's one mixture that just has worked really well over the years is make a strong tea from just regular chamomile that you can just buy in a grocery store. Just get maybe a liter of water or half a gallon of water and put like 2 or 3 tea bags of chamomile in there, and get the seed cloves, the clove seed. You can just get it in a grocery store in a spice section, and you want not the powder but the seed itself. So you put maybe like 3 or 4 of those clove seeds in that chamomile tea, and then you put it like a couple of teaspoons of just regular table salt, and you boil this, you make a tea of it, you make it as strong as you can, and you just kind of let it cool to room temperature, and you just rinse with that. The cloves in this mixture have the pain medicine properties. The chamomile has the anti-inflammatory properties, and the salt has the disinfectant properties. So I think it just works really well, and we've used this for years, especially patients who maybe had like a tear on their gums or some irritations from brackets or braces, and it just seems to work better than like the alcohol-based mouth rinses, because those tend to not allowing the area to heal real well. Even if you have dry socket, like if you had an extraction and you got a dry socket, they may put you on an antibiotic, but you rinse with like a strong alcohol-based mouth rinse. It just doesn't want to allow that area to heal. You can have your doctor give you like an irrigation syringe and get this tea mixture of chamomile tea, cloves, and salt, and fill that irrigation syringe with, and just irrigate the area with that, and I think you'll find that it works really well. If you have any questions, let me know. Hopefully this will help you. And again, if you had orthodontic surgery, just make sure you check with your doctor to see what kind of rinse they want you to use, and hopefully you find a chamomile tea, cloves, and salt mixture helpful. All right, any questions? Send me an email. Have a good day. Bye.